All right, guys, we're live. We're here with our monthly StreamYard interview series. Today we have a returning guest, our first returning guest, Mike Stanlaw from Stanlaw Fitness. How you doing?
Pretty good. What's up? Good to be
Dr.
back.
Mike, Dr. Mike A, how are you, buddy?
Good to have you, Mike. Good, good.
Good to be
Good
here.
to have you back, Mike. Thanks for coming on.
All right.
Always.
So we are going to talk about joint health and support. And I'm not sure how long the conversation will go, but we have a couple targeted points we want to talk about. We'll try to focus a little bit on the knees and the elbows and the shoulders, but overall, we're going to just talk about different strategies from all of our different perspectives on joint health and joint support. So I don't know where you guys want to start or how you want to start or who wants to go first, but what do you guys think?
If it's cool, I'll just, all of us were kind of spitballing ideas of, what to talk about and, what's relevant or what's important. And I just thought I would throw it out there that at least what we see and probably what a lot of you guys see in in the studio and with your guys' practice is a high injury rate, a lot of issues with knees, a lot of issues with elbows. And I don't know why, but it just seems like it's more prevalent lately than usual. So I figured let me see if I could pick the doctor's brains about what we could do to help joint support, what we could do to improve it, especially for people that are very physically active. So it'll be good to get some insight so I could hopefully relay the message back to everybody.
Dr. Mike, I want to start with a theory first. We have like 7 target points, but you've had a theory for a long time about why professional athletes are blowing their elbows out and those things. And would you like to share your theory before we get into some more concrete stuff?
Which conspiracy theory are we talking about?
Just the elevated antibiotics in milk and dairy and just affecting the pitcher's ligaments and such.
Yeah, it's really interesting. Injuries are always going to happen in athletic endeavors, in working out, but the prevalence of, as Mike said, the prevalence of these injuries over the last couple decades has gotten to really, I would say, an epidemic proportion, like a true epidemic. And one of the things that I did was in researching this, because baseball pitchers are always going down with injuries to their rotator cuff. You're seeing thoracic outlet surgeries, compression and impingements. And the interesting thing is, and it's one of the talking points on the list, is nutritional component. But our food and dairy have a residue of antibiotics in them. And when you look at what the literature says about antibiotics and tendons, they're specifically listing Achilles tendon tears. And it's just fascinating to me that over the years we've seen more and more and more of this. And we know that outside of organic, it really will impact the body. So it's not a great leap in looking to what we're intaking and how that impacts our body.
I think that's a great, I don't say conspiracy theory, but it's definitely a great theory because if I could use even myself as an example, there's times I try to use myself as almost like a little science experiment. And I see if there is a day where I take in a little more sugar than I should, I notice not a major difference, but a small difference in how the joints feel the next day when I'm running. Doing a lot of running lately, getting ready for this turkey trot on Thanksgiving, but doing the running or doing the lifting, and just how it feels, not only maybe a little inflamed, but maybe like some minor pain. So there has to be a major link between, what, like you said, what we are putting in our bodies, and the joint and the elbow and knee pain. So I think you're right.
Yeah, it definitely behooves you to limit the amount of antibiotics that you consume, whether it's just antibiotics for illness or antibiotics in your food. And we know that antibiotics are most readily used in dairy and non-organic meats. But when we look at the nutritional component overall, um, when you're talking about joint health, you're always, and this is really goes for overall health. You want to look at an anti-inflammatory diet. High quality meats, lots of veggies, cruciferous vegetables, fruit, olive oil, olives, nuts, and seeds should be like the core of just about every meal. And if you want to get more specific, leaning to what Dr. Mike said, if you're really having joint problems and they're not really resolving themselves, this is a time when you can really look at dramatically decreasing or totally eliminating gluten and dairy. And Mike, I know just from your history, you've had on and off shoulder problems, and it typically resolves itself pretty quickly, or it had in the past when you totally went gluten free.
Yeah, I've been gluten free for 14, 15 years, and had on and off shoulder problems since high school, uh, when I played baseball at prep. And once I cleared up the diet, once I went gluten free, that pain went away completely. Now there's an interesting things that we can look at when it comes to nutrition. Is it the actual gluten, or is it the stuff that they're spraying on the gluten before it gets processed? We have friends, good friends of ours, that have traveled to Europe, Greece, Italy, Spain, and when they go there, they do not have issues with gluten.
Hmm.
And it's because it's not sprayed with certain pesticides before they mill it. Where here, once it's milled, it's sprayed like, I believe it's a day or two before it's harvested. And maybe that's what's causing all these problems. We don't know.
Is
So,
there any way that um, you think people can kind of educate themselves a little more into this one topic with, maybe experimenting with a gluten-free diet or just different things in that respect?
I'll give you an easy guideline, Mike. We always say, Mike and I, try something for 30 days and see how you feel and function. That's a true test, man. I mean, there's tons of blood work and there's all sorts of things you can do, but the tried and true way is to try anything for 30 days and see how you feel and function.
Absolutely. That's a good way of doing it, because everybody is different too, and everybody has different factors. But I never thought of it that way before. But yeah, try something for 30 days. I like that.
Yeah, I don't, I think that you have to give yourself 30 days.
Because
Number,
there is so much information out there,
yeah,
and
it gets confusing.
yeah, and you guys are very credible sources but somebody might say, hey, this doctor said one thing, this doctor is telling me another thing. How do they really know? And I guess it's the same thing with, or same and different with trainers and different training philosophies and different nutritionists. The only way to really find out is take guidelines and try it for yourself, see what works.
Yeah, totally. Number two, and I think we talked about this the last time, and we talked about it when we were at your place. When you're dealing with your joints, whether you're running or working out, you need to do some sort of dynamic warm up in the beginning. And I'm a big favor of doing static stretching after workouts, and that to me that pretty much speaks for itself. I don't know if you guys have anything to add in that point.
Yeah, I mean, we really try to, with every one-on-one session, with the group exercise classes, always try to do a warm up, obviously before, stretch after. That being said, if somebody it really is going through a lot of pain, or they're having chronic pain or tension, it doesn't always alleviate it, but at least it lets them know, hey, maybe take it a little bit easy today, because as we, get a little older and we go through, I know, Dr. Noah, you're a big runner. So it's constant stress on the joints, and even personally, I just took up, running again a couple weeks now, and everything feels good, thankfully. But those first couple times, you're getting the kinks out, and you're like, all right, this feels a little funny here and there. So you always have to warm up. You always have to stretch out after, and hopefully that adds to the longevity of your program. Is it gonna make a big difference in a matter of a couple days? Probably not. But just getting into that practice overall, I mean, there are some people that I think take it to the extreme where I've seen 30-minute warm-ups and with the foam roller and sitting on the lacrosse ball, and I mean all that stuff is awesome, but you just got to find out what works for you.
To me, the foam rolling and lacrosse balls, that's a separate session. That's a session that you do when you're watching TV at night and you're kind of just hanging out, and you
Yes.
got 40 minutes, and then you could do a 40-minute, 30-minute foam rolling, lacrosse ball, deep tendon, whatever. That's not a before a workout thing for sure.
Mm-hmm. Painful
Cool.
too.
It is. And then of course it goes without saying, if you're doing an upper body workout, there's different dynamics such as for upper body, and if you're doing running, there's different for lower. I mean, that goes without saying, but when we're looking at your different joints, there's going to be a little bit different workouts. One of the hardest things I have to ever talk about with my patients is weight, and it's a touchy topic, but let's face it, if the thinner you are, the trimmer you are, or the not being overweight dramatically decreases the pressure on every single joint in your body. Whether it's, your knees probably take the brunt, but it's certainly going to affect your ankles. It's certainly going to affect your hips. If you have a big belly, it's going to pull on your lumbar spine. Anything to add about that, guys? Because, it's a touchy subject.
Yeah. I was just gonna say, it really is, even with one-on-one sessions here. When I say here, I mean across the street. I'm in my car right now. Yeah. Big blue building across the street. I do tell a lot of clients that, and again, you're trying to be as tactful as possible. That when you lose the weight, you will alleviate the stress, on the joints. I've done it myself, putting on, trying to put on some size, and even though, some body fat there, you feel the stress, push-ups are harder, pull-ups are harder, on your elbows. And when you're lighter, it's just natural. You're going to feel better overall. Your joints are going to feel better, whether you're pressing, whether you're running, whether you're doing anything. So it makes a major difference. Not easy to do, but weight loss helps with. There's a whole list of everything, and joint stress is absolutely one of them.
Absolutely.
Anything to add there, Dr. Mike?
No, pretty straightforward. I think you nailed it.
The next topic, there's so many ways to look at this, right? So when we look at your feet, do you want to use max support? Do you want to use minimal support? Do you want a big toe box? Do you want to use 5 finger toes? Do you want to work out barefoot? And and this is a topic in and of itself. And what I tell people more recently is, if you want to find out what the best type of shoe wear or sneaker wear for you is go to Fleet Feet in either Montclair or Hoboken. Get a really good scan on your feet. Talk to the people there. I prefer the Montclair store. I've been going there for 35 years. But the Hoboken store is good too. And they'll guide you through choosing the best pair of sneakers for you. So when you go to Fleet Feet, they'll scan your feet, and they'll literally bring out 8 to 10 pairs of shoes that you could try, run with, move around with, see what you like, see what you don't like. And that's been my suggestion. Now, I own a couple pair of minimalistic 5-finger toe shoes that I wear when I work out, not when I run. I never wear when I run, but I do use them when I work out in other forms, and I really like them. But those have to be used very carefully, and you have to build up a tolerance for them. But my suggestion has been for quite some time is go get your feet scanned at Fleet Feet and see, what works best for you.
I would say it is amazing. I think how far we've come with, just going from running to, you can go to the store now, go to the shoe store, and they put you on the treadmill. They scan your feet. They, like you said, bring out 8 or 10 different pairs of shoes. It's incredible. I think how far we've come with all of it. Again, it could also add to the confusion. Maybe sometimes there's too many options, but also, for somebody that's taking it seriously, for somebody that's really trying to step up their game, or maybe has certain issues with their feet. I mean, these things are incredible that these options are available to us, because if I have a client asking me, I'm not the most well versed in running or advising somebody, what to wear. And again, there's the, when you squat, do you do barefoot? Do you do flat shoes? Do you do Nike shoes? So you're better off going to an expert, or to one of you guys that can give them a little bit better advice and guidance.
I'm not a gym rat, Mike. I work out a lot, but I like to work outside, and I run, and I'm yoga, and I bike, and all the different types of things. Is there specific shoes for gym, like that aren't like considered like running shoes? I literally don't know.
You know what? I try to avoid the expression, they tell you, because it's like, first of all, who's they? And you do need to find out for yourself. But I found personally that while exercising, while lifting, specifically on things like squats and deadlifts, flat shoes or barefoot is really the best way to go. And the reason I say that is more from not so much a joint standpoint, but from getting a better mind muscle connection while you're doing the exercise. I feel like having your foot almost gripping the floor, you feel all those stabilizer muscles, those smaller intrinsic muscles, as opposed to maybe a more comfortable shoe that rocks a little back and forth. That's just my opinion. Like I said, using myself as a guinea pig, and also my clients, but that's just my take on it. That being said, if you are doing more aerobic activity, of course you're going to need something a little more like a Nike shoe, or I don't know what's popular now. Hoka, I think, is a big name. They got the Asics, but for me personally, yeah, flat shoes work for squatting and deadlifting, and just gives you that better mind nerve connection.
Yeah, I that's you said that much better than I did. When I do a lot of like goblet squats and sumo squats with kettlebells and stuff, and I do that totally with either barefoot or in 5-finger shoes, and I wouldn't do it any other way. But when I run, I'm running with Brooks, and let's face it, like if you look at your feet, if you're pronating, that that definitely has an impact on your knee. If you're supinating, that affects your knee. If you're super flat, that affects your knee, and whatever affects your ankle affects your knee, then affects your hip, and it's just like the knee bone's connected to the hip bone, and so on and so forth. So it's your foundation is more important than you think when you're talking about joint health, because that'll eventually translate all the way up into your shoulders and your neck as well.
Yeah, I mean, I think you really nailed it right there, because it does all start with the feet. So if somebody has issues with their feet, like you said, the knees, the lumbo-pelvic hip complex, the neck, and for somebody that's wondering, why things might be going wrong in one area, it's all connected, and that can make things very tricky for somebody to kind of pinpoint where they're at. So it all starts with the feet.
Yep. Number 5, we could talk about supplements till we're blue in the face, but there are a couple tried and true supplements that have shown to be very beneficial for joint health. The two that come to mind for me, one is something that you could take that's very anti-inflammatory, and that's turmeric or curcumin. Lots of research showing the benefit of anti-inflammatory properties, and that helps with joints for sure. And then, of course, there's glucosamine, chondroitin, and MSM. and you guys can add whatever your thoughts are on here, but glucosamine and MSM are absorbed much easier than chondroitin. So where Mike and I have a joint formula in our office that is basically glucosamine and MSM, and that the research shows that that's absorbed much better. And just a side note, with any kind of joint formula, you typically have to take it for prolonged periods of time to show benefit. We're talking about anywhere from 1 to 3 months. It's not something that you could take for a couple weeks and see benefit, because your body needs to get those supplements on a regular basis to help support those joints and to rebuild joint tissue. So just an idea, if you ever decide to jump into that glucosamine MSM type of joint support, just know that don't bother if you're not going to go in for the long haul, is what I'm trying to say.
Yeah, I think the same supplement that you recommended, that's usually the ones we talk about here at the studio. Off the top of my head, I really don't think I could think of other options besides that. Your healthy diet and all those supplements are pretty legitimate for good joint health. So I agree.
I don't have it listed here, but I'd like to bring up one other supplement per se, and that's collagen. I am a massive, enormous fan of collagen, anywhere from 10 to 20, 10 to 30 grams a day. Remember, that's not included in your normal protein intake because of the different amino acids. But I feel that consuming collagen on a regular basis, is one of the greatest strategies to support your joint health.
You turned so many of our members onto it last time you guys spoke in front of everybody here about collagen. And I've never really tried it before, but just from doing research on it after you guys spoke here at Stanlaw Fitness, so many of our members to this day still talk about how they take it regularly and how it helps them. So absolutely.
All right, because we actually have a question, so I'm going to throw it out there, and then we'll answer it, and then I'll respond in the comment section. So Michelle asks, does the try for 30-day rule work when adding supplements? So just like we said, 30-day try for just about anything, about when you're trying a new diet, gluten-free, dairy-free, does that rule work for supplements? What would you say about that, Mike? Mike A or Mike S?
It depends. It all depends. When we're talking joint issues, it takes a lot longer. There are, if you're taking magnesium for sleep, that's pretty immediate. So great question, Michelle. It really depends. The long and short of it, in my opinion. What do you guys think?
No. Sorry.
You can go, Mike, please.
Sorry. With the 30-day rule, again, I think it depends on the person. I mean, I don't know, how long it takes the body to build up a tolerance to certain supplements. I don't know, if it's variable from supplement to supplement. I would imagine that, taking anything, I think for 30 days, you would probably notice some kind of difference. And again, everybody's different. And I think a lot of times that there could be a placebo effect with a lot of people taking certain things, but you really, I think, have to be in tune with your body and seeing what works. So, but I would imagine after 30 days, you'd probably feel a difference or not.
Yeah, I think with food, I think the 30-day rule is wonderful. With supplementation, a lot of times you need to work with somebody when you're talking about specific supplementation, for sure. There are some tried and true things like joint formulas and joint supports, 30 to 90 days. But like Mike said, most sleep support formulas and formulations and magnesium, those are immediate. So just supplements are something that's fine tuned, and I would suggest working with a professional when you're talking more about above and beyond a multivitamin. And the other thing, Mike, great point about magnesium. Mike S., let me ask you about this, because I've changed my thoughts about this next topic a little bit over the last couple of years. Ice versus heat.
I've heard that both are good. I've heard that in terms of like vasodilation, vasoconstriction, opening and closing the blood vessels, I've heard it's good to do both. I've really done a lot of research on cold showers and ice baths and things like that, and I've even scary enough found ways to work my way up to taking cold showers. It's not it's not fun at first, but like anything, you could get used to it. Heat definitely loosens everything up a little bit. I would say for somebody to try both and again see what works for them, it's going to be person to person, and of course depending on their level of either pain or things that they're looking to accomplish. But I do believe that both definitely help. So even I think last time, I don't remember if we were on the show here or at the studio, we were talking about contrast showers, how that helps out as well. Pre and post workout, I think is where it kind of eludes me. Where do you do before, after? I would, of course, before the workout, you want to warm up a little more. But then after, do you do ice? Do you heat? So yeah, good question.
Mike, your thoughts?
Uh, Ice and heat, to me, it is dependent on the person. So when you get somebody who's a little older, 50s and older, there's indications that heat will help, especially if you're looking at joint issues. More of the younger athlete, it's just to try and reduce that inflammation, and ice is fine. But what did you look at that you thought would change? Why change your opinion
Well, I
on what?
mean, historically, it was elevate, compress, and ice after an injury, right? And
Mhm.
there's a lot of people, including Kelly Starrett, who I think is a magician, said compression, yes, but heating is becoming more of a after an injury because you want to bring more blood flow, you want to flush that area. He's pretty, he's pretty clear in saying ice, the best thing that direct ice has is for pain relief. So if you're in agonizing pain, to help with the reduction of pain, ice is much better than heat. But for healing, heat may be the better option. Now, this doesn't mean cold showers and ice baths. That's a hormonal recovery type of strategy, not necessarily something after to recover from an injury. So if you're looking for that hormetic effect or that recovery, I think ice is fantastic. And I also think sauna has its place. But if you have a direct injury to like your knee or to your ankle, compression and heat might be the better option.
Interesting. I think it's something a lot of people can benefit from, and a lot of people do not take the, or maybe don't make the time in their day to take these measures. I know there are athletes that pro athletes, but also have the resources and the means to be able to treat themselves to the ice, the heat, the massages, the all the doctor's visits during the day. For your average person that's rushing around and trying to juggle work and gym and family. It's hard for somebody to take the time and to do all these things. Not making excuses for anybody, but I think if there was maybe another seminar that we can do just on ice and heat alone, ways that somebody can take care of themselves, in that respect. I know, one of the big things here in town is, and I think they still have it over there, is the Arctic, the
Mhm.
cryotherapy,
Yep.
and they get in that giant container and it goes to like negative whatever degrees. So I know there's a lot of education over there for somebody to do something like that. So maybe, like I said, in a future seminar, if we can kind of help people in that respect, I think it would open up another way that people could treat their bodies and aid in recovery.
Yep. Some other biohacks that we can talk for hours on. Of course, taping. We do KT taping here. All of us basically do some form of it for sure. Vibration plate, red light therapy, pulsed electromagnetic frequency. These are all things that you can kind of look into on yourself. That some are a little more expensive, some are a little bit not so expensive. But my children use both vibration plates, red light therapy, and PMF on a regular basis for recovery and for joint health. So just something to think about. And that, Mike, that could be another lecture on these biohacks that can be used, including things that they have at Arctic too, like the Normatec and the salt chambers and the nitrogen freezing yourself, whatever they're called.
And this is, I mean, why even personally, you know, on a selfish and not selfish level, why I love connecting with you guys here is because, you know, as you know, the years go on with, you know, with our clients at the studio, like I said, you just hear so much about all this, these aches and pains. And, you know, our goal is to get everybody results, you know, from a health standpoint, you know, a lot of times just from a, you know, of course, from a cosmetic standpoint, whoever wants to, you know, boost their confidence levels through their physical appearance. But, you know, none of these things are possible if there's chronic pain, if there's, you know, your joint pain all the time, if somebody's hurting. So I like being able to refer people to you guys. I think my client Pete, he said he was coming to see you guys today. I don't know if he was in or not today, but yeah, but I always try to send them your way. And, you know, my goal as, I guess, as a studio owner, you know, in addition to getting everybody results, is just to keep them healthy, you know. So when I hear things like this, like, hey, my knees, my lower back, my elbows, you know, that's why I'm glad I could connect with you guys to help everybody out.
Yeah, I mean that's basically our last topic. You know, joint the alignment of your joints are crucially important, and that's where chiropractic, PT, and even acupuncture comes into play. If your knee isn't tracking right, it's not going to be a healthy knee, right? If your shoulder's not moving right, it's not going to be a healthy shoulder. If that scapula or the ribs that attach to your spine are misaligned, they're going to injure quicker. And then the same thing goes for you, Mike. If you're working out in a way that's inefficient or bad posture or bad form, that's gonna affect your joints. So these things sometimes get underlooked or not paid attention to, but form, function, alignment is crucial for joint health as well.
It's everything. And we, you know, myself and the, you know, awesome instructors here at the studio, you know, one of our main goals is, you know, for everybody that's whether it's a one-on-one session or whether it's the classes, is to really just pay such strict attention to form. You know, we're not going to have somebody lifting very heavy, you know, if their form is not correct, because everything has to be in alignment. And even when you are lifting heavy, I mean, things, you know, could still go wrong. But, you know, when your form is right and you have that better mind muscle connection, everything usually works better. And you're able to make those strength increases and endurance increases even more effectively with proper form. There's no point of getting stronger if the joints aren't working correctly, if your form is wrong, because it's just going to lead to injury. You know, I think social media and Instagram have found ways of finding me with their crazy algorithms, and I keep getting all these gym injury videos that come up, and I try to avoid them, but it's like the car crash you can't look away from sometimes. So yeah, a little scary. They're listening.
Any last words today, Mike? Dr. Mike?
Oh, no, I'm good, guys.
Okay. Mike S., anything?
I was kind of wondering the whole time if you guys are in the same building or not. Is it like different rooms?
We are, yes.
We are.
Well, no. In all seriousness, if anybody is struggling with any, elbow or joint pain, knee pain, any, definitely come check you guys out, because I know you've helped a lot of our members here, and I'm very grateful to have you guys as a resource, because I can help people with with our team, with getting stronger, with getting leaner, but any business, especially in the fitness industry, we have to have that connection with the community to be able to say, hey, talk to these guys. They're helping in ways that we cannot. And I think that tying this into Bayonne and the community, I think if more people are able to refer clients and patients and in any industry out to other people, it just helps everybody overall. So I think everybody does need to learn to work together like that a little more. So grateful for you guys for helping so many of our members and all that you guys do. So thank you.
Same, Mike. Same.
Absolutely. Thanks, Mike.
Good night, guys.
All right, later, guys. Thank you.
Bye-bye.
Thanks for coming on, Mike. See you soon.